Welcome to the Virtual PA podcast.
Hello everyone. Today we are going to talk about virtual personal assistants in healthcare. Think about how much time healthcare professionals spend just trying to keep everything running smoothly, managing appointments, shuffling paperwork, and dealing with administrative headaches. It's a huge drain on resources, right?
Absolutely. And the real challenge is that every minute spent on admin tasks is a minute not spent on direct patient care, which is what really matters in the end.
Exactly. That's where virtual personal assistants come in. They're designed to take over those time-consuming administrative tasks, freeing up healthcare providers to focus on their patients.
The efficiency they bring is remarkable. For example, just with appointment scheduling, VPAs can streamline the whole process, reducing double bookings and ensuring fewer missed appointments. It's all about creating a smoother workflow.
Yeah, it's a game changer. I read about clinics, physiotherapy ones for instance, that were struggling with scheduling inefficiencies. They brought in VPAs to handle it, and the turnaround was incredible. Waiting times dropped and patient satisfaction soared.
And it's not just about filling slots efficiently. It's about having someone that ensures practitioners spend their time where it's most valuable. Patients ultimately feel the difference.
Right. It's a clear win-win. Clinics get operational efficiency, and patients experience better care because their practitioners are less stretched. I'd even argue this is becoming a necessity in today's healthcare environment. Now, let's talk about boosting efficiency and patient experience. Building on how VPAs streamline operations, they're also a game changer when it comes to patient follow-ups. Consistency is key here, making sure no patient slips through the cracks after their appointments. Wouldn't you agree?
Exactly. Things like timely reminders, follow-up calls, or even sending updated treatment plans. These aren't just administrative tasks. They're an essential part of good patient care.
Yeah, and they're like time-sensitive too. I mean, let's take mental health practices as an example. Ensuring clients stick to their schedules or receive those follow-ups is critical. VPAs do this seamlessly, text reminders, secure messages, it's all streamlined.
That's a great point. And it's not just about keeping appointments on track. It's about creating trust. When patients feel cared for, when they know the system works for them, it reduces a lot of their stress or anxiety, especially in more sensitive areas like mental health.
And think about the knock-on effects of that. More engagement means better health outcomes. The right treatment gets delivered at the right time. Honestly, it's a win-win for everyone involved.
Absolutely. And you've said it before, it's a journey. VPAs kind of act like a guide on that journey, making sure it's seamless, reducing disruptions or unnecessary barriers for the patient.
That's a really good way to frame it. It's not just about efficiency, it's about enhancing the entire patient experience. And, that kind of impact is where VPAs thrive. Now let me tell you my thoughts about transformative impact and scalability. One of VPA's greatest strengths is how easily they adapt to practices of any size, making it possible to expand without bringing in the complexity of hiring and training extra staff.
Right? And that's huge, especially for smaller practices. They might not have the budget or even the need for a dedicated staff member, but they still require professional administrative support.
Exactly. And the cost effectiveness, it's a no-brainer. You're paying for the hours or tasks that are actually needed, nothing more. It's like having a custom solution without the overhead.
And not only that, it's the quality of the work. I mean, things like ensuring accurate patient records or handling GDPR compliance. It's all done without the errors that sometimes come with overstretched staff.
Yeah. I read about a clinic, actually, scaling up their operations with VPAs. They'd grown so quickly, but managed to keep everything running smoothly because the VPA services adjusted right along with them.
That's such a great example. It shows that VPAs aren't just filling a gap. They're providing real, tailored support that can evolve with the needs of the practice.
Right. And the best part is that this scalability isn't just operational. Practices can actually focus on improving their patient care outcomes because they're not bogged down by the admin side of things.
And that's where VPAs really shine. They take away the busy work and give healthcare providers the freedom to focus on what they're best at, helping people. It's such a simple concept, but the impact is profound.
Couldn't agree more. You know, the more I think about it, the more it seems like VPAs are more than just a tool. They're partners in redefining what's possible in healthcare management. And the scalability, it's like having a safety net, but one that grows with you. Honestly, it's hard to imagine the future of healthcare without them.
Absolutely. And on that note, John, I think we can safely say that VPAs aren't just revolutionizing healthcare. They're making it smarter, more adaptive, and ultimately more efficient.
Couldn't have said it better myself. And that's all for today. What a great conversation. Thanks for joining us, everyone. Until next time.
Yes, thank you. Take care and goodbye.
Stay tuned for our next podcast.